Hi everyone, I am Dr. Bharat. I am currently working as a consultant dental surgeon in Yashoda Hospitals, Secunderabad. Today I am here to talk to you about the temporomandibular joint, the diseases caused to the temporomandibular joint, and the causes, symptoms and the treatment for it. So what is a temporomandibular joint is? In this model we can see the jaws are opening and closing at one particular hinge axis. So this axis in our mouth is called a temporomandibular joint. Okay? So it's simple, opening and closing. So why does this joint diseases occur is, as you can see, the jaws are opening and closing at the same time. So whenever they're closing, the contact should happen at the same time on both sides of the teeth. If these contacts are not occurring at the same time, that will cause imbalance in the joint. This imbalance causes the temporomandibular joint diseases. So why does this imbalance occur is, whenever there is a tooth loss, the adjacent teeth will migrate into that space. Because of that migration, the contacts will be disturbed. First cause. The second cause is whenever you have any systemic diseases like arthritis or hypocalcemia or any calcium related diseases. And the third cause is iatrogenic, which is very rare. Whenever you go to a dentist, if a dentist is restoring any of your teeth and the contacts are not even, that also causes your TMJ disease. So what are the symptoms occurring is, you will feel clicking in the joints, and whenever that clicking happens you may feel mild pain which will escalate and cause severe pain. So what is the treatment is, if you come early to us like in the clicking stage, we can adjust the contacts and we can place a splint. Splint is nothing but whenever you are closing the jaw, the joints are under pressure. So without this pressure, we can move the jaw to its original position and we can splint it there. So what happens is, it will be relieved of the pressure. The joints will be relieved of the pressure and the treatment will be done. Another course of treatment is a surgical treatment that usually happens in severe cases, whenever the patient is not able to move his jaw freely, and whenever there is an open lock position, the patient opens his jaw and is unable to close, or there is any major anatomical difference in the joint, then we'll go for a surgical option. So surgical option is very rare. We can use it or we can treat it conservatively. Thank you.
Like, comment and subscribe for more health updates.